A continuous glucose monitor can provide arguably the most helpful biologic data available right now. And in this video, I'm going to explain how to use a continuous glucose monitor to optimize your health. I'm Dr. Grady, and I specialize in holistic medicine, where we look at the whole body to identify the root causes of illness so we can then support the body in the right places to allow it to balance, self-regulate, and heal itself. So first things first, why should I use a continuous glucose monitor if I don't have diabetes? Well, as a type 1 diabetic myself, I've closely monitored my blood glucose for almost 20 years now. Let me tell you, I've learned a lot about my body from that data. So much so that at times it almost feels like a superpower having type 1 diabetes. Glucose levels provide a big window into what is happening in the body, arguably more than heart rate, blood pressure, HRV, or all the fancy little things that you get on your fitness trackers. And that's because glucose is not just an indicator of metabolism. Glucose in your body affects nearly everything, and nearly everything affects your glucose. That's things like sleep, stress, activity levels, types of activities, food, inflammation, digestion quality, thyroid function, hormones. The list goes on. And you can get a good glimpse of what's going on in the body in these different systems and these different problems by monitoring your glucose levels. And because of this, you can identify how certain foods, habits, stressors affect you positively or negatively, and to what degree. And therefore, you can tailor your diet, your exercise, your sleep cycle, and habits to optimize your health. Or at the very least, you can understand the consequences of making poor health choices. And that's why I think everybody should wear a continuous glucose monitor at some point in their life. Because let's face it, things like glycemic index are straight up. You don't know until you test it on yourself. I'll give you a great example of this in my own personal life. I'm type 1 diabetic. One of my good friends is also type 1 diabetic. We also have a podcast that we talk about diabetes and blood sugar on, called the Diabetes Podcast. But we both used to live together, and it was interesting to see how our blood sugar responded differently to the same things. One of the most extreme examples of this was bananas. When I eat a banana, my blood sugar doesn't spike for an hour. When he eats a banana, his blood sugar spikes right away. Knowing that information is powerful because now you know which foods you do really well with, which foods not so much. And you're not just relying on research that's done on random people that's not you and not your body. Identify the ideal ranges and ideal scenarios that you want to be shooting for. So at all times, you want the range of your blood sugar to be between 80 and 140 milligrams per deciliter. If anything spikes you over 140, something needs to change. And when you're fasting, so anything over 2 hours after eating, you want to be within the range of about 80 to 100. If it's higher or lower, again, something needs to change. And how do we use this information and how do we tailor make our diet and our lifestyle? So first, you want to observe food. How does food affect it? Write down what you eat and the resulting blood glucose elevation. What is the peak height? How fast did it get to the peak height? And how fast did it come back down into range? And then did it drop down below the ideal range after it came back down? So any food that spikes you above 140, you know you can't handle by itself. You may not be able to handle it at all, but you can at least try a few things to see if you can handle that food. By eating protein, fat, and or fiber before a high glucose or a food that spikes your blood glucose high, that can help slow down the absorption and therefore allow you to tolerate that food a lot better. You can also try eating or consuming that food before or after exercise and seeing if you can tolerate it at that point. If you've tried all these things with that food and it still spikes you above 140, you're going to have to cut that out. Next, you want to observe your fasted states. So again, that's anything at 2 hours or longer after eating. If you drop below 80 or 70, sometimes there's a little bit of a range there. Some people do all right with that 70 to 80 range, but especially once you're below 70, that's too low, and then your body's going to start kicking out cortisol and adrenaline, so that stress response to help bring your blood sugar back up, and that's not something we want. So this drop below 70 can happen either when you're coming down sharply from a high glucose number, or it can be happening because you're going too long without eating. So when things are coming down too sharply, oftentimes you need to incorporate a little bit more protein with that meal to help stabilize that blood sugar for longer periods of time. At the same time, when you are dropping lower and going too long without eating, again, protein can help out with that. So if you have more protein throughout the day, you can tend to go longer and longer without eating without that blood sugar dropping too low. If you feel like you're eating enough protein and still having no trouble with dropping low, sometimes that's just a matter of your digestion not working well enough to digest that protein. And so you're going to need to work with somebody to help out with that digestion to make sure you're getting the full benefit of eating that protein. Next thing, you want to observe how sleep and stress affect your blood glucose numbers. Because once you identify those foods and you got everything pretty stable, now that next variable is oftentimes stress that will cause irregular spikes that don't really make sense to you. So the most common time for this is in the morning, because in the morning you get a cortisol spike, which is a natural spike, but sometimes it's too much of a spike because there's too much stress on the system, and therefore you get an increase or a spike in blood sugar. And so since it's the morning, you've gone 8+ hours without eating, so anything above 100 is going to be a high glucose number. And so if you're above 100 in the morning time, typically that's a sign that you're either not getting enough sleep or that you're just too stressed out overall, whether that's mental emotional stress or some other stress on the body that's causing that cortisol to be heightened. Another point I should make is if your blood sugar is already consistently above 100, let's say you're type 2 diabetic or you're pre-diabetic, then you want to be looking for an increase of about 10 to 20 milligrams per deciliter as you're too much of a cortisol spike in the morning time. But then if you're saying to yourself, I'm not type 2 diabetic, I'm not pre-diabetic, but I'm still always above 100, then that's usually a sign of chronic stress or chronic sleep deprivation. If it's just for like 1 or 2 days where you're consistently high like that, then obviously it's probably some acute stress or just an acute sleep deprivation. Like let's say you get 3 hours of sleep one night because of some weird reason, then you're probably going to have a higher glucose number relative to your normal for at least a day, if not maybe a couple days. The next thing you want to monitor is exercise and different forms of exercise and how your body responds to those different forms of exercise. Because essentially your body may be adapted and or just more efficient at performing different forms, like maybe running versus weight training and anywhere in between, because each form can put a different stress on the body. So when you look back at your CGM data after doing an exercise, you can look and see, is it spiking above 140 again? Obviously, if it's spiking above that, probably a little bit too much stress on the body, and therefore that adrenaline and cortisol is spiking and causing you to pull more sugar in. Probably should avoid that, or at least work on a few things to try and see if you can help your body perform that exercise better, more efficiently, or you just may have to work your way up to that level of intensity. Also, I should point out that that 140 number isn't as perfect for exercise as it is for food. So you want to match it up with your symptoms and how you're feeling too. So let's say you're spiking above 140, but you actually feel pretty good, not just from like a sympathetic and I feel good point of view, but like throughout the rest of the day, you feel recovered, refreshed, and you sleep well at night, then you're probably doing all right with that form of exercise. However, let's say you don't quite get up to that 140 range. However, you feel really drained at the end of the workout, and at the same time, you feel fatigued the rest of the day, you get poor sleep that night, and your glucose levels remain a little bit more elevated throughout the rest of the day. Well, that's a pretty good sign that your body's too stressed out from that workout, and so you may need to back off a little bit. Now, this effect on your glucose from exercise can change depending on your sleep that night, the overall stress you're already under, and so when you add more stress on top of that with exercise, you may not handle it as well as maybe when you're not under stress. Hydration levels at that time, and how much food you've intake. If you're pretty deprived and in a fasted state, you may have a more increased spike in blood sugar because your body is really trying to produce more sugar for that energy production with that exercise. And that's really common when you're doing morning workouts fasted, because you've just gone 8+ hours without eating, and now you're pushing your body hard, trying to burn up more glucose that it probably has already burned up the storage of glycogen in the body. and therefore you're putting more stress on that cortisol and sympathetic system. This is really common in females, and that's why oftentimes females don't do super well with fasted exercise, and oftentimes that will cause them to either retain weight or it just stresses their system out so much that it affects them in other ways too. Now, there's other things to look out for that can affect your blood sugar, whether positive or negatively. We talked about hydration, alcohol consumption, caffeine, and stimulants, because again, that's going to put more stress on the sympathetic nervous system and stress on the body in general. Any new supplements that you're taking or medications that you're taking that may be affecting things. And that way you can really hone in on all these little things that you're doing to yourself / taking and seeing, hey, is this helping me or is it hurting me? The next question is, how long should I wear one? Ultimately, it should be until you've collected enough data to design your optimal healthy lifestyle. So you've got your diet squared away, you've got your exercise squared away, you know how much sleep you need to get, and how to use different stress reduction techniques to reduce stress on your body. All those good things, once you've kind of figured out what works best for you and you have those good solid tools to make you feel and function better, that's a good time to say, hey, all right, I think I got this figured out, and now go on my own, do my own thing. However, if you're somebody that needs that extra motivation, that needs to see that data in front of you to say, hey, this is bad for me, I slipped up here and I can see it on my app and on my phone, well then keep using it and use that motivation to stay consistent. Also, you check in on yourself periodically and use it to see, hey, is this food still working for me, or is this form of exercise still working for me, or is this new job stressing me out too much and that's why my blood sugar, or that's why I feel funny. Or let's say you're implementing a new supplement or you're trying out a new diet and you're changing things up and you want to see, hey, is this diet working for me, or was the diet I previously was on doing better for my blood sugar and overall stress in the body? Next question I usually get is, how long do they last? And of course, this depends on which one you get. I would say the two most common ones that non-diabetics can get access to are the Freestyle Libre and Dexacom. And so Dexacom is about 10 days for each sensor, and the Freestyle Libre is 14 days. And then lastly, how do I get one if I'm not a diabetic? First, you can go and see if your medical doctor will prescribe you one. Talk to them about what you're trying to accomplish with it, and hopefully they're understanding enough to where they will write you a prescription for it. If you can't get a prescription for it, there's a couple companies that can provide you access to medical doctors that will help you out with that. The first is NutriSense, which are pretty expensive. They come with a membership that's fairly expensive, at least in my opinion. The other one is called Levels. They're a little bit more affordable, and typically the route that I push more patients towards for that reason. However, I do have good news. Dexacom is coming out with a over-the-counter CGM that's going to be available in the summer of this year, so 2024. So if you're thinking about getting one, you may hold off on that, because hopefully they're going to be more affordable and obviously easier to get as well. So you can look out for that in the summer here. So that's all I got for you today. If you like this video, please hit the like button down below. And if I missed anything, or if you have any questions, leave a comment down below and I'll be sure to answer them. And remember, if you take care of your body will take care of you.